Hello, my name is Kiersten Henry. I am a board member with the American Association of Critical Care Nurses, as well as the American Association of Critical Care Nurses Certification Corporation, and also a critical care nurse practitioner practicing in a community ICU.
Good morning, I'm Yanick Rice Lamb. I'm a professor of journalism at Howard University, an independent journalist specializing in health and co-founder of FierceForBlackWomen.com. I'm also a member of the National Advisory Council of the Center for Health Policy and Media Engagement at the George Washington School of Nursing.
Yanick, thank you so much for being with us.
Thanks for having me.
So the original Woodhull study on nursing in the media was published in 1997 and was replicated and updated in 2018. What was your role in communicating the results of the study?
Initially, I heard about this plans for the study as a member of the National Advisory Council, as I mentioned earlier, but I also participated in the release of the study at the National Press Club. I was one of the journalists who spoke about the study and added some media context to that. And I've also helped to organize and participate on panels at the National Conference of the Association of Healthcare Journalists.
20 years apart, the findings were similar. Nurses were identified as sources in about 2 to 4% of health news articles. What do you make of this lack of progress, and how do we change that?
I think the lack of progress is unfortunate, and I think it reflects what's going on in the larger society in terms of women and in terms of coverage of women and including their voices in stories. And then also the lack of representation of nurses when people are looking for medical experts to include in stories. This changing a little bit with the pandemic coverage, and hopefully that continues beyond the pandemic, but we'll have to wait and see.
So you've started to answer my next question, which is, with the ongoing coronavirus pandemic, nurses have been on the front lines and in the headlines. How has the media changed its view of nurses and the demand for seeking their experiences and their voices for health news and feature articles?
Well, the story of the pandemic is a story of people. So in order to tell that story fully, journalists had no choice but to include nurses, because nurses are on the front line. And you would be missing a significant part of the story if you didn't include their perspective. And so nurses help to tell that story because they're dealing with the patients, they're dealing with the families, but they're also dealing with a lot of other medical issues that affect hospitals and that affect the healthcare system. Sometimes that part of the story has been skewed in terms of not including nurses more broadly in covering medical issues. But I think when, particularly when you're talking about people seeking care, people seeking testing, people seeking vaccines, you had to include nurses. And then just also the lack of PPE at different points in the process.
For the 19th straight year, nurses have been ranked as #1 as the most trusted profession in the 2020 Gallup poll on honesty and ethics. What do you tell established journalists and your aspiring journalism students about seeking nurses and interviewing them as sources for health news?
Well, I also tell people to look at their own experiences. When we interact with the healthcare system, who are we dealing with the most? We're dealing with nurses most often. They spend more time with us than physicians actually do. And a lot of times that's where we get the most complete information. So you're telling an incomplete story if you're not including nurses. And just as you need to have the everyday voice of everyday people like patients, you also need a diversity of voices in terms of the experts that you need in your stories. And also kind of learning more about the nursing profession too, because it's not just bedside care. So nurses are in the hospital room, but they're also in the boardroom, and they're in a number of different other roles. And I don't think the public hears about that enough as well, and that maybe journalists aren't as well versed on that, themselves.
Social media seems to be a platform that has a presence of nurses who speak for nursing issues, who blog, who video blog, who share experiences. Is there an interplay between that and people that are tapped as sources for news articles, or do you see those as really two separate venues?
No, I think that is a good point too, because a lot of times nurses and nurse organizations and nursing schools can also follow journalists and follow journalism organizations so that they're kind of in their stream and they're commenting on the coverage.
Your mother and sister were nurses. During the panel discussion, when the new Woodhull Study results were presented to the press, you told a story about how, as a journalist, if you're not listening to nurses, you're missing the story. Tell me more about that, please.
Yes, I think that's really important. And one of the stories I shared was I mentioned listening to nurses and listening to your mother. And I've gotten story ideas from my sister and my mother. My mother passed in 2014, so it tells you how long she's been gone. But I remember her talking about drug usage and pain medication and things like that. And if I had paid a little more attention, I would have been on the front end of covering the opioid crisis, particularly because I grew up in Ohio. In Ohio and West Virginia and some other states were kind of at the center of the opioid crisis, particularly in the beginning.
Well, as a nurse, I have to say, I truly thank you for helping our bold voice be heard, and helping us continue to figure out how to do that more. What advice do you have for nurses on how to be valued media sources, establish their voice, and be effective storytellers?
I think also that nurses can also, tell their own stories too, maybe even, try to do some writing. A lot of times you see people telling stories, say on Medium, writing stories there, or just even sharing stories on social media. And I know sometimes they have to be careful about what they release, but sharing those stories, making themselves available too, because sometimes people don't think about, as we talked about, referring nurses to be experts. So sometimes you have to kind of reach out to the people who interact with the media to let them know, I'd be interested in doing interviews. Or if you have whatever media exists within your organization, is in addition to any kind of medical journal writing that you're doing, but just for even nursing websites and publications or things that are dealing with the public, or even blogging, to take advantage of those things to build your own communication skills. A lot of programs are doing more narrative storytelling that are connected with health education in different forms, whether it's for physicians or nurses. And some of it is not always journalistic, some of it's fictional as well. But there's so many stories that nurses see all the time that they have, and kind of just sharing those stories so it helps people understand different things.
Yanick, you spoke about storytelling, and one of our challenges in this year plus of the pandemic is focusing on the well-being of our nurses and supporting them through, and the entire healthcare team truly, through this unforeseen healthcare crisis, and something that causes fairly constant stress for healthcare workers. The storytelling piece has become a way that American Association of Critical Care Nurses has supported our nurses through their work with StoryCorps and with Dear World, who's developed a documentary around the story of nurses in the pandemic. And how else do you see that storytelling being a piece that we can use not only for the external facing community and public, but also as a way to build well-being and resilience within nurses who are experiencing this?
I think it's really important to do that. And it's good that you're involved with StoryCorps as well. But even if you're just writing it for yourself, and no one else sees it, I think that's really important. I've found it cathartic for me, whether I've written about deaths in my family, or when my mother had dementia, or more recently, I'm working on a series that's about the impact of the rubber industry on health in Akron, Ohio, in Northeast Ohio, where I grew up. And, those are things that I've experienced and people in my community have experienced and had a lot of questions about. And the response has been phenomenal. And I didn't realize how much, it was a release for me in terms of, doing those stories over the years. So I think it, particularly with nurses dealing so much with this pandemic and seeing so much illness and seeing so much death, I think it's really important to kind of have a release for those kind of things, and to share those stories. I mean, to capture those stories, because this is also, it's a historic moment as well. But I think it kind of fuels you to keep going to share those stories, or like I said, even if you just write them for yourselves.
For people watching this who would like to really walk away with kind of what's most important for them to focus on if they'd like to expand their relationship with the media or become involved in this realm, what would you say are the most important things?
I would say, again, remember that it's a relationship and start trying to build it to, reach out to journalists. Journalists love to hear from members of the public. That's, we like talking to people. That's one reason that we went into this profession. And we like getting feedback about our work so we can improve it or so we can do more of it if you think it's wonderful. So reaching out through social media or through emails or phone calls or whatever. And, sharing story ideas, what worked, what didn't work in a story that people are working on, but also, sharing your own experiences, making yourselves available, offering assistance, being a resource that's really important, and making sure that your voices are heard. And also making suggestions about other things, other people, other topics, trends that are emerging in healthcare, because a lot of times nurses see things that, are emerging as problems, or they see solutions to things, or they fix something themselves that can be spread, that people may not be aware of.
Thank you so much for taking the time to share your perspective and your expertise with our community. We greatly appreciate your work and all the insight that you've shared with us today.
Thanks for inviting me.